particularly social care, into social care. That would be my idea. The problem is that even if all the money that's collected from national insurance went into health service, it would not be enough. So one of the solutions that has come up, not just by me, but by a couple of economists, as I know, both in the Lords, is that everyone who is earning any money at all from whatever source, even after retirement, should pay national insurance, which includes me, because I get a free ride. I don't pay national insurance, and I suspect most of you don't pay national insurance. And doesn't sound very popular to the people who've got past the age of 67, retirement age, but I think it's inevitable that we should be paying national insurance, and that would go a long way to do two things. One, it would help to pay for the health service and social care. It would also redistribute the burden of paying for health care in the elderly from the young, active, to everyone else. So that's the sort of solution we propose in the book.
Okay. There's someone right at the area end, at the last row.
Can I take issue with two things that you said? I too am a retired consultant, only 20 years this time. One is the physician assistant. I think one of the major problems is that there's no agreed training or final qualification. And I do think that's a major problem. If you have a physician assistant sitting opposite you, you've no idea how much they know, what they're doing, or anything else. My other thought was, I think you, maybe deliberately, I don't know, underplayed the stress that is on the junior doctors. Yes, there was the 48-hour rule. Now that is missing in so many hospitals, it's ridiculous. There's a lot of pressure put on junior doctors, that I know, to do double shifts, to do whatever. And whilst the whole concept of shift work is difficult, I'm not sure I was any safer when I was a junior doctor and had one night off a week. I think there has to be a limit, but it's the managers that are pressing more. And in that situation, I think it's extremely difficult to bring back a team. Otherwise, I agree with everything you said.
Well, no, I think you're absolutely right about the 2 points you made. One about the training of the junior doctors and the stresses they're under. They're a very unhappy lot. And are leaving, many are leaving early on, and I think their lot is very stressful. I didn't talk about the fact that they rarely are able to have their 48 hours, but they are, the care that they provide is very splintered. They know that they're running around from ward to ward, finding patients that they're supposed to be looking after, and having to move on in quick rotations. I don't think it's a very good system. We've got to change the rotational system for training of junior doctors. As far as the training of physician assistants, I agree entirely. They've got to have a proper training program. I mean, absolutely right. No, I agree with you.
Okay. Any more questions? This person here near the pillar, please. The gentleman next to the pillar. Okay.
All right, you can hear me. Well, just coming back to something else that gets mentioned many times in the press is the amount of money wasted in the health service and the bureaucracy. And you haven't really covered whether you think that there's a level of bureaucracy which is just getting in the way of everything happening. Would you like to comment on that?
Yeah, I think two elements to it. One is the bureaucracy that a patient has to go through in order to get access to services. If you apply for any of the care support systems, particularly in the community, there's an enormous amount of bureaucracy, and we really must sort that out. The other area is the talk about the administration of the NHS. people say there's far too much, far too many administrators. In fact, 5% of the health service costs go in administration. And that's very low in international comparisons. In America, the administrative costs are enormous. The insurance companies gain enormous amount of money from it. In Germany and in France, the administration is very expensive. We're very cheap on administration. Doesn't mean to say the administrators are very good or that we've got a lot of excellent administrators. We need better administrators. Excellent administrators can do an enormous job. And one where I worked in Salford was terrific. David Dalton, he integrated the care in the community and in the hospital very successfully. So good administrators can do a great job. We may not have entirely good administrators everywhere, but the numbers and the costs are not excessive by any means, factually.
And Raymond.
Yes, thank you very much for your talk. I have a question about the inability of the NHS to advertise what it's got. And for example, we have these local hubs, GP hubs. Lots of people don't know they exist. They go to A&E instead. If you ring 111 in the evening, you can ask to speak to a duty doctor. A lot of people don't know that. So why don't we tell people about what actually is there that they can use and is underused?
That's a good point. Good points, yes. We certainly could do more advertising what good things there are available, and there are good things available. Many of us have taken advantage of those.
Okay, any more questions? This gentleman here next to Anne Neumann.
Thank you very much for the talk. You've identified a lot of problems and put forward a wide range of solutions. Do you have any optimism that any of these will be enacted?
Not a lot. I think there's a very steep uphill learning curve to go. I think it is extremely difficult with limited resources and distractions. People are distracted by trying to provide solutions from the top. I've always thought that solutions should come from what the patients need and then work up that way, rather than a new management arrangement at the top, just drift down. And getting that approach is not always easy. But we are left in a lot of disarray when so many people who work in the service are disillusioned.
I think we have time for 2 more questions. There's a gentleman there over there by the window, and then one more after this. Thanks.
Can you hear me?
Yes.
I think I should say hypothecation is not the answer. It's a slippery slope, because once you award 2 P for something, and you want another P for the police, another P for special needs or whatever. So hypothecation is not the answer. The other thing that I think we should consider is the possibility that AI might help a lot with the administration that you referred to in the surgeries. I know the doctors in our group practice are faced with enormous amount of correspondence and reports, as you report. So AI may be on its way to being. Do you have any experience of that at all?
As far as hypothecation is concerned, you have enunciated the arguments of the Treasury very well. They're very reluctant to hypothecate because it takes an element of it limits their capacity to do things with the money they get in. So they're not very happy with hypothecation. So that'll be an uphill struggle as well. AI, I'm sure it's going to have a part to play. It's not quite clear exactly how it's going to help the clinician with the patient. it will help in medical research, it'll help in drug development, it'll shorten new drug developments, and it may well help in the administrative areas. It's not sure yet what part it will play. People are looking at it very closely. I am naive as far as AI is concerned. I just found ChatGPT on my telephone, and it was quite interesting what I found.
Okay, one more question. Is there someone over there? Okay. This lady at the edge of that road, and then that's
Hello, can you hear me?
Yes.
Hi, thank you very much. Thank you. I think it's something that we all sign up to. It's something that we're all concerned about.
Speak up, please. Speak.
Sorry, can you hear me?
Yes.
Yeah, I thank you very much. I thought it's very interesting, and it's certainly something that we're all concerned about, and we want to support the NHS care sector going forward. My observations about the care sector. About 20 years ago, I was head of health and social care, and we did have a range of programs to professionalise people in the care sector. Whether they still exist, whether people are signing up to do them, whether they go into colleges or training centres, I'm out of date now. We brought in MVQs, which only qualified people for the experiences they were getting within the care homes. I have doubts about that, really, whether it was actually giving the right training to people and the qualification. I then moved on, and I was head of a national initiative to professionalise the early years sector, which has very similar parallels with the care sector. You know, we're looking at children 0 to 7 years, whereas this is the other end of life where people still need the care, they still need the stimulation, they still need the support. A very, very good programme was introduced under the last Labour government to professionalise and provide a career structure for the earlier sector. My question is, to professionalise the care sector, which you made a good observation about, we had a national initiative that worked. How do we lobby the government to bring this sort of structure back in, and to keep the commitment going, because the commitment under the last Labour government was taken away by the Conservative government. So it's a very...
Yeah. Well, keep lobbying your MP, and we do need to do something about the career structures and training and job opportunities for people in the care sector. They are neglected and badly treated, and we must do something for them.
Thank you, Lord Danbo. You could tell from the rapt attention of everyone in this room how closely concerned we are with this topic.
Yes.
I think your most radical suggestion was that we should all pay national insurance, even as older people, because we are, after all, the ones who are most in need of the NHS. And I think we should, as older citizens, support this. Anyway, Lord Danbo, brilliant talk and so interesting, and we'd like to give you a very small present.